My friend, my name is Dr. Shaker, and I'm an instructor at Mount Wachusett Community College in the PTA program. And I'd like to confirm your identity. Is it Deborah Pinto?
It is.
Could you tell me your date of birth?
January 13.
Okay, great. So let me explain what we're going to do. We have a list of bony landmarks, bones, that I'm going to examine on you. I'm going to demonstrate the skill known as palpation to examine with touch. It shouldn't hurt. I will apply a little bit of pressure, but if I do anything that causes any discomfort, I need you to let me know, and I will either stop doing what I'm doing or adjust my pressure. I will be physically putting my hands on the shoulder region. Okay? So do I have your permission?
Yes.
Okay. So I'm going to go through the landmarks for the shoulder girdle. Now I'm going to move the camera up a little bit. Okay. And let's do your right side. Okay. So I'm going to start with the sternum. And here's the sternal notch. The very superior portion is the manubrium, the body, and I can slide all the way down to the very end and find the xiphoid process. Okay, come back to the sternal notch, cross over the sternoclavicular joint. Now I'm sliding along the clavicle, keeping contact. And if I go too far, now I'm on the acromion process. So I'm going to back up just a little bit so I feel the lateral clavicle. I slide over a joint. That is your acromioclavicular joint. Okay, so far so good? All right, so back to the sternal notch, clavicle. I'm at the lateral clavicle. I'm going to drop 3 fingers down and start looking for the coracoid, and I think I'm on it. Is that a little sensitive right there? No? Okay. How about right there? Put your hand on, yeah, put your hand on your tummy, your right hand, and I want you to push your hand into your tummy, and I feel the coracoid moving into my finger. Pectoralis minor, which would be right here, is pulling the scapula forward. Okay? Terrific. All right, let me just make sure I have everything on the list from the front. And I believe I do. And so now it would be much more helpful if I could actually see the landmarks. And so do you have a sports bra on?
I do.
Do you mind taking your t-shirt off just for a few seconds? And I will demonstrate these landmarks again for educational purposes.
Okay.
I'm going to have you turn and face that wall. And then flip your t-shirt off if you don't mind. Terrific. So now I'm going to move over to the left scapula just for positioning purposes. And I'm going to put my hand on your head. So here's your occiput, your occipital bone, and there's a little protrusion. That would be the occipital protuberance. Okay? Now, Deb, do you mind putting your left hand in the small of your back? Super, and just relax, okay? And now you can relax your arm, all right? You can move it back to the, so that's the inferior angle. I'm going to slide up the medial border. Here is the spine of the scapula. If I go over to the very medial part of the spine of the scapula, again, put your hand behind your back so they can see where the scapula is. There's the spine. That very medial portion is the root. Here's the spine. If I slip my fingers above, this represents the supraspinous fossa. Back to the spine, the infraspinous fossa. Now again, inferior angle up, spine of the scapula, and I will ultimately end up on the acromion process again. Okay? Back spine down. Here is the lateral or axillary border of the scapula. Relax your arm. Now I can go up, here's the spine of the scapula again, go a little bit superior. I think I'm on that superior angle. Shrug your shoulder, and I can feel the levator pull my finger superiorly. We'll show you the muscles in the next video. All right, terrific. Now let's see. Let's just look at a few of the vertebrae here. All right, now remember, you bring your chin to your chest. The most prominent vertebrae is C7, and now you can look back up. And now arm behind your back again. Here's the inferior angle. If I go straight over to the vertebral column, I'm on the T7 spinous process. If I slide up to the spine of the scapula and I go straight over, I'm on T3 spinous process. Spine of the scapula lines up with T3. Inferior angle lines up with T7. Chin to chest, C7. Okay. And I think, oh, now we want you to, do you mind laying down? You want to put your shirt back on? Okay. I'm going to need you to lay back down on your back. And I'm going to just take this away. Okay. Head this way, feet that way, knee bad. All right. Now, let me get the scapula out of the model. Okay. We want to try and palpate the anterior surface of the scapula, which it sits against the rib cage, so not as easy as it might look. All right, so there's Deb. And I'm going to angle this down. That's good. And so I'm going to have you just lift your arm and just bend your elbow, okay? And right now, because I've moved her humerus out of anatomical position, her scapula has upwardly rotated, and I have my fingers on the anterior surface of her scapula, okay? So I can feel, here's her rib cage, and her scapula has moved away from the midline, and I'm sitting on the anterior. It's a very lateral portion, but I am on the anterior surface of the scapula. So you can just relax for a sec. And again, so what I did, Deb, do you mind holding this camera? Hold it right there like that. A little higher? Yeah, perfect. So I had her move her arm, her scapula upwardly rotated, and I put my fingers right here. Okay? We'll practice that in lab. The anterior surface of the scapula. You're only on the outer third of it. Perfect.